What was your journey to becoming a genetic counselor?
So my journey to becoming a genetic counselor really started in undergrad, where I earned my bachelor's degree in biological sciences and minor in chemistry and psychology. It was actually my genetics professor who taught me about the profession or told me about it as well. And I did my research on my own and kind of looked more into it and seeing like what it took and what was the field like. Ended up doing a job shadowing at Cleveland Clinic where I got to have hand in one hand with the profession and ended up thinking that this could be something that I could do. It included both the sciences and also like the psychological interest of people as well. And so then I ended up going to the Ohio State University where I earned my master's in genetic counseling.
How did you choose your genetic counseling specialty?
So the way I chose my specialty was really in a way I felt like it chose me. At the time, I was in my second prenatal rotation, and I remember telling my supervisor that I don't know, this is probably not a specialty that is for me. I felt like at the time I wanted to do conservation or cardiovascular genetics, and I didn't feel that prenatal resonated with me. It was actually a one-on-one patient experience that really highlighted the fact that maybe this is something that was for me and that I could be very impactful in this space. Reproductive rights are being under attack nationally wherever we are, and people who have those abilities to conceive are being limited in the options that they have. And being a prenatal genetic counselor gives me the opportunity to not only help them with their genomic care, but also help them realize what would be the best decisions for them moving forward for their pregnancy.
What does your typical workday look like?
So, a typical day for me as a prenatal genetic counselor includes checking in on my ultrasound techs, my doctors in the ultrasound rooms. And then I take a little bit of time to prep and chart for my 3 to 4 patients that I see a week. Once that's done, I typically have some time. I would call up some results. I use it as kind of the better part of my day to give some people some good news or just informative news at that time. And then that's typically what a day as a prenatal genetic counselor looks like checking in on ultrasound, prepping and charting for my patients, and then calling out some results.
What is the most challenging aspect of being a genetic counselor?
So, one of the most challenging aspects for me as a genetic counselor is really the psychological and social implications that a patient may come into the room with. Oftentimes, you only see a patient once for 60 minutes, and talking about genomic care, genomic medicine can be very complicated for some patients. Also, countered with the fact that we're also dealing with some of the social and psychological implications that they do come in with. And so it can be very challenging with the limited amount of time that we have to have these patients in our care to evaluate, see is genetic testing and counseling is something that they want to pursue or not.
What do you like most about being a genetic counselor?
The thing I like most about being a genetic counselor is actually the thing that I find most challenging, which is the social implications that patients come in with on a daily basis. And the reason that is because once you're able to talk through a patient in that amount of time and help them figure out what it is that they want from seeing you, it can be really rewarding for yourself and for the patient that you've done the job and that you've helped them figure out what is the best choice for them moving forward.
What advice do you have for aspiring genetic counselors?
The advice that I would give an aspiring genetic counselor is the advice that I give most often, which is be yourself. Oftentimes, there's not a right or a wrong way to practice and be a genetic counselor. And so when doing so, going into the room with the patient, they oftentimes can feel your uniqueness and your authenticity and really feed on that. And that can help to build a great relationship or rapport with that patient. And so, for anyone out there who's thinking about genetic counseling or working towards being a genetic counseling now, remember that it's always better to be yourself and do things in a way that feels comfortable to you.